Okay, well, seeing that the room is filled up with numbers, again, thanks for joining us. We're going to get the webinar started. For those of you who have attended in the past, we hope you have. We've been putting on a series of virtual roundtables and webinars over the past several weeks since the public health crisis has started with COVID-19. And we've been trying to offer, at least a few times a week, the ability to engage with housing officers and outside experts to discuss issues that are pressing on college campuses and beyond. Today, we're going to be discussing with a group of really great senior housing officers who all agreed to be here with us today, talking a little bit about the ability to convert residence hall space to external medical facilities for either staff or patients or things like that as well. So we thought this was a pressing topic. We wanted to make sure that we gave some voice to this as well. And so we have 3 SHOs who are with us today that are going to be sharing some of their perspectives. And we will get started with that really, really shortly. Just to let you know, we're going to be, we have several resources online besides our webinars. All of these get converted at the very end to YouTube recordings. So if you've missed this, if you'd like to share it with colleagues, if you'd like to go back and watch it again, we have a YouTube channel and it's available off the ACU Hawaii website that you can go and watch these again in full. And so we welcome you to do that. We also have the online community for ACU Hawaii. It's a great place for housing officers to share different perspectives, ask questions of each other. And we're hoping, and we're seeing a lot of people use that, asking questions on a pretty daily basis. So we're hoping that you'll continue to use that resource at each other. We also have a page of COVID-19 resources that we put together off the ACU Hawaii website, off our main page. And so it offers just different links to various organizations, bits of information, data that we've been able to dig up that hopefully you'll find useful and interesting to be able to put into practice and have discussions with your staff and reflect on individually. So we're hoping that you find those useful and we invite you to visit those. So today I want to introduce our co-facilitators. First and foremost, we have Josh Hartman, who's the Director of Residential Life and Learning at Tufts University in Boston. Jeff Novak, who's the Associate Vice Chancellor for Finance and Administration and also the Director of University Housing at the University of Wisconsin-Madison. And then finally, Cindy Janney, who's the Dean of Students and Director of Residential Life at Minnesota State University, Mankato. So join me in welcoming them. We're really pleased that they've been able to be here with us today. A couple of notes about today's session. Some of you may have been to previous webinars where we have done formal presentations and it's more lecture-based. These are not that way. We're tending to lean towards a conversation-based format here where we ask a few preliminary questions of our panelists to get the conversation rolling. And then we really want to depend on your engagement and your questions. So we'll offer the ability for you throughout the webinar to hopefully post some questions and be able to ask those, and we'll pull a selection of those and answer. Obviously, we have a limited amount of time today, so we may not get to all of them, but we're hoping that we'll get an opportunity to get to some of those. And so what we'll do from here, sorry about that. You can use the Q&A button on your Zoom menu. It's at the very bottom of your Zoom module. You should be able to see a Q&A function. That is the easiest way to submit a question. We would ask when you submit a question in writing that you state your name, position, and institution, and then your comment. It'll just help us find you quicker when we go and get to your question. We may answer those just based on the text you send over. If we have some time, we may ask you to ask those questions live. So I'll ask you to unmute yourselves and introduce yourselves and then ask your question live if we have some time to do that. And so there may be other folks in that Q&A or in the chat function that may ask you to read the question or comment. Other folks may comment on that for you. So we're hoping that all around, this is just good conversation and good contributions from everybody who will be here. So wonderful. Okay. So what we're going to do is we're going to get started. And one of the things that we've been talking about before the webinar started this afternoon was a little bit about where each of these places are at in terms of institutions. And so I'd love for Josh and Jeff and Cindy to talk a little bit about where, at what stage their institutions are at in terms of either contemplating or considering or fully implementing alternative medical spaces in their residence halls, just sort of as an introduction. So if the panelists could each just share a little bit about what they're doing on campus right now, what the roles have been, and any information that might be helpful for folks to know about where you're at right now. So Cindy, I guess we'll start with you.
Okay. I think Mankato is the newest to this relative to Tufts and University of Wisconsin. We are talking about and preparing apartments for healthcare workers to live in. And we had a walkthrough yesterday of state emergency managers, Army Corps of Engineers, Department of Health, and others to look at using a residence hall as overflow space for hospital overflow space for non-COVID patients.
Great. Jeff, what about yourself?
Thanks, Grant, and thanks to everybody out there across our colleges and university and housing colleagues for everything you've been doing over the last few weeks. We all are one big family and know what you're going through, and you're all making a difference, I know. For us, we've been working closely with our UW hospital right now and exploring options, site visits with the very real potential of starting very soon here to use it for practitioners and various levels of practitioners in terms of their interaction with COVID-19. So for those that would actually have been positive or are positive with COVID, placed in one residence hall, those who are working with COVID patients and out of an abundance of caution are not wanting to return to their own homes for risking their own families, and then a group of practitioners not working with COVID patients, but just out of sheer convenience and not having travel time back and forth to a home that might be an hour away because they're being taxed to help with heavier loads in their non-COVID areas, just want an easy place to be able to travel back and forth from work. And then lastly, just another group of unknown, just feeling comfortable, not feeling comfortable returning to their homes to perhaps risk their own family. So 4 kind of different populations, which has been unique for us in kind of determining how we then would service each one and who would.
Josh, go ahead.
Sure. So just wanted to echo what Jeff said in terms of the thank you to Huhuai for having us here, but also for all of you out there. I know this has not been a really easy time for any of us on a personal or a professional level. So, you know, we're all together on this one. Hopefully this conversation will be able to at least help folks who are in the early phases of talking about these things. So Tufts, depending on where you're at in the country, Tufts has made the news a bit. In terms of our university president being very out front in terms of calling on other universities and colleges to open their facilities to the local community and to the healthcare system. And so we've been working on this for a little bit now. We were one of the earlier universities to decide to shut our residence halls. We did that in like around March 11th. And so we've had a little bit more time to kind of like think through what the next steps are. So similar to Jeff, we are exploring a couple of options for supporting our local communities. In addition to supporting our healthcare workers, which we have a lot of hospitals in the Boston area, including one associated with Tufts. We're also looking at supporting our first responders, so our local community, police, fire, EMTs, others. We're also looking at supporting patients, hospital patients who are not at a critical or ICU or even really frequent monitoring kind of a level, that are more in a recovery level, that would be under the hospital supervision, but they're looking at some of our spaces for that as well. And we're pretty far in our process too. We anticipate moving forward on some of these things probably in the next few days even. I mean, it's coming pretty quickly, our peak over here in Boston. So the need is definitely there, and it'll be hitting pretty soon. So we're pretty far along.
Sorry about that. Need to unmute myself. So if you can talk a little bit about how you select the facilities. And so as you've been having some of these preliminary conversations, how do you choose what residential facilities to offer? What are some of the criteria that either you've been looking at or that local health authorities have been looking at as sort of suitable places for these extended medical facilities?
I can start, I guess. So the first thing that we did is we thought about our students. So this is our institutional mindset here, is that we have to make sure that our undergraduate and graduate students who can't go home or don't have a home to go to are still being supported through our housing infrastructure. So that was our very first step in terms of figuring out where should we put our undergraduate and graduate students. We determined that we were going to consolidate our students together into a residence hall building that has single stall restrooms. At Tufts, we don't have private bathrooms in our rooms. It's mostly community, like shared restrooms. And so we moved our students into a building where there are a lot of single stall restrooms, which allows us for a lower ratio of use and easier cleaning, actually, for our cleaning folks. And we also only have that building half full, so we have folks spread out throughout the building. We also held a couple of apartment units that have bathrooms in them, specifically for our students for isolation or quarantine if we needed to use them. And those buildings are not on the block of things we're offering to our community partners. In terms of looking at stuff for the different needs of the community, our expectation and the hospital's expectations are that some of the healthcare workers, even if they are healthy when they come in, it's likely that they may wind up needing to quarantine or isolate at some point. So we've thought about what kind of spaces can we give them that can flex one way or the other. Usually apartment spaces are good because they have a bathroom in them and you can kind of like, bounce back and forth if you need to. And for the patients, for patient spaces, we were looking at spaces that would in some ways resemble a hospital. Shockingly enough, our double loaded corridors are actually a really good layout for this kind of a thing because it's easy access for the nurse and doctor staff to be able to get into those spaces. And we also were looking for elevators as well, just because we didn't know the mobility of some of our patients and the need for elevator use. And so we've kind of focused on that. And then the last piece is that we looked at the electrical load in the building because we don't have central air conditioning on our campus. So thinking about how long this might go, if it goes into the beginning of the summer where we may need to put window AC units, we want to make sure we're in a building that can support that for our patients and healthcare workers.
For Mankato, we master lease an apartment complex that's about a block away from campus. And so we are consolidating our remaining residents into specific buildings and then making other buildings ready for healthcare workers. It's helpful to hear Josh's distinctions on levels of healthcare workers' health because we'll consider that as well. The building that we toured with state emergency managers is a newer building. It's a semi-suite style, so 2 bedrooms sharing a bathroom. Their directive from the governor was to find locations that can hold 250 patients, hospital overflow patients that are not COVID patients. And so their evaluation initially has been focused on building systems. So HVAC, electrical, they asked some IT questions as well. So if you are about to do a tour, the preparation I can offer to you that I didn't know about is to have your facilities director available and to if you can offer them some floor plans to describe your spaces. They did comment that if they were using our spaces, they would tear the carpet out, which is we only have carpeting in common areas, so that's not as difficult as it would be if we had carpeting in rooms. And that they would do other supports like amending ventilation to achieve the kind of ventilation standard that hospitals have. They were not interested in touring our older buildings, our 1960 vintage double-loaded corridors.
Yeah, this brings up a lot of great things. Certainly as we gave initial tours to the hospital, they latched right on to the bright, shiny new facilities. Even though once you got into the bedroom, they were all pretty much the same. Here on our campus, we house about 8,000 undergraduates, and they all pretty much are double-loaded corridors. So other than some being a little newer, maybe a tiny bit bathroom ratio to a person staying there, not a whole lot of differences other than keying in on some that might have food service in it that would potentially be utilized for the practitioners if they liked. I think for us, some learning lessons, if I could share, is early on, try to control the process as much as you can, and gear them and recommend them to the buildings that you'd like to first utilize. For us right now, of our 4,300 rooms, we still had over half of them occupied because of when this all happened to us across the country. We said, students go and then come back, and then now you can't come back. So we've been boxing and storing belongings in rooms, and we've been looking at that based on where can we get the most beds without having to box and store, or with boxing and storing the least amount. So that's helped us kind of dictate which facilities we wanted to use there. But yes, as Cindy mentioned, bringing in your environmental health and safety folks from your campus, encouraging those from the hospital to come as well, meet early, have those discussions has been immensely helpful, and something that can't be done soon enough in preparation for this.
One other thing, as you both were talking about the tours, and I couldn't agree with you more, Jeff, about kind of knowing what you want to offer on the front end instead of giving open rein to all of the spaces. One thing that we did intentionally is that we have a huge hill that splits up our campus. So we have about 4,000 beds, and half of them are uphill and half are downhill. And we made the intentional decision that one half of the campus would be what we would look at for outside partners, and the other half would only be for our university community, meaning our students, our staff, if they need it. And there were a lot of reasons for that, but the primary is, we want our students to know that we're not turning in the building next to them into a hospital ward. Like, we want them to realize it's still their campus. And then to the point about floor plans, on the first walkthrough I did, we had a couple of floor plans, and the hospital folks were getting really excited about the floor plan. So we decided that in the future walkthroughs with other groups, we weren't going to give them a floor plan until we determine the building, because they get really ahead of themselves. So unless you may want to think about at what time you do that. But the floor plan point, they definitely need them, especially as they're thinking about dimensions of the room, whether or not wheelchairs can fit through the doors. It's super important that they get it at some point for sure.
Yeah, just to add, as you're thinking about that too, and the use of it is again, we're looking at practitioners right now versus patients, though that need might come. Is this a revolving hotel type setup? What staffing is going to be involved? Are these a practitioner using it for a home for 2 weeks, or nightly, and then daily cleanings based on that? And which population is it being used for dictates the type of cleanings and who might be doing it that you're going to need to look at.
I think kind of bouncing off things that both Jeff and Josh have said, something that became apparent to me at the walkthrough was that we were dealing with multiple agencies and there wasn't one clear leader. And so it's important that you use your housing director skills to provide some leadership to the group. And when they came in as a group, an engineer started asking engineering questions, and somebody else wanted a floor plan. And so, and also the people who are coming to do these initial walkthroughs might have been at their own desk jobs just a few days ago and just have moved into their emergency manager role, or there were some people who had just been called up as a part of their National Guard or Reserve role. So I think your leadership is an important component. So I think I was assuming that the group would show up and there would be some leaders as a part of that. And it was pretty clear pretty quickly that it was important for me to provide some structure.
Well, I'm going to, we have a question, and it's Quentin Cotan from University of the Free State in South Africa, and he's been sitting with his hand up patiently. So I'm going to let him talk. Quentin, I'm going to unmute you so you can ask your question in person, if that's okay. So go ahead.
Hi, everyone. This is Quentin Kutan. In my day job, I'm the Senior Director for Housing at the University of the Free State. And my part-time job, I'm also President of ACUOI, the South African chapter. Our university is explicitly pro-poor and serves peri-urban and rural communities, and our campuses are in those areas as well. Our campuses are being regarded by both the students and the community as a safe haven. So if that call come for university residences to be turned into hospitals or something close to that, we might sit with a possible clash between the community and the students. By the way, when the crisis started, there was approaches made by the higher education and minister to us to avail our residences. And at that stage, the students were on their way home already. So some of our students left their stuff, and we cannot ask them now to come and fetch and so forth. So are there any other institutions sitting with a similar situation? And I would like to know, how do you manage that? Thank you very much.
Thanks, Quentin.
If I understood the last part directly related to boxing and storing belongings, was that it, Quentin? Yeah, we had a good 3,000 to 3,300 students that, you know, we got the governor order to kind of self-isolate and stay at home order. We ended our move out, and lots of students' belongings still in there. So we've hired an outside company, professional services, to come in and box belongings. As we've identified building by building, I'd like to avoid doing it all. So as space is needed, they've been here since Monday now, and we're starting to get a good idea of the number of rooms that they can get done on a daily basis and how much time then we'd have to be able to get another set ready if the need keeps coming. So we've in those buildings, we're about 50% occupied. Our cleaning crews have cleaned all the rooms already that were unoccupied, and then as the movers box up, we're cleaning right behind those, getting the other spaces. We were clear in our communications when people were coming back to get their belongings that we were being approached by state and local hospitals to possibly use our space, that we encouraged them to come back and let them know at any time that if we had to halt the process, we might need to box and store your belongings. And then it did come, and we told them we were boxing and storing your belongings. And I've said to many, it's amazing how you can get a lot of emails right now of people just very concerned and can't thank you for all you're doing, and at the same time they slam you as well. You know, how dare you touch our stuff? But that's why we went to a professional company, hired them, worked that out, and are making those spaces available as we go.
Just to quickly follow up on the storage thing, and I see that April sent us a question about like who's paying for the storage piece on this. For Tufts, our students had a little bit of time to get themselves out, so we worked with our exclusive moving and storage provider, who generously agreed to provide free storage for the rest of this semester to any of our students, and then regular summer storage prices after that. So if students want to keep their stuff in storage over the summer, they are going to pay for that. But if if they just needed somewhere to store stuff until May, not a problem. It's being taken care of for them. They actually boxed it up themselves. So we didn't need to be in a spot like Jeff was, where we had to send folks into rooms. The students actually did that before they left, because we were fortunate, maybe the wrong word, but fortunate enough that we made the decision to close a week before our spring break started. So we were able to tell our students to go on spring break, but just go. The other piece to Quentin's question about the community impact and the potential clash between the community and the campus. I mean, the one thing that I would say to that, at least what we've been dealing with, this may be a different angle on the question, but our president is a medical doctor with a public health background and is viewing this as there's a global pandemic and we need to do what we can to support our communities during a time of crisis. And as an institution that purports to be part of our community and supporting our community, we should be supporting our community in several ways. First of which is minimizing the amount of social interactions happening on campus and doing what we can to reduce community spread, but also doing what we can to support our local medical infrastructure and our first responders. So that line, like that wording, is what we've been saying to our students, to our families. And honestly, our students and families really get it. Initially, they thought that we were kicking them off campus because we needed to make room for other folks. But now, as things have gotten not so great, they're realizing that it's actually better for them to be in different spaces other than on campus. And I think that the folks who we do have on campus, which we have about 150 or so that remain, they do feel as though it's a safe and supportive campus, even with everything that's going on around it, because we made those efforts to make it feel that way.
Right. We have a question from Monica Pugh, who's the Dean of Residential College at the University of Monterrey in Mexico. She wanted to know if health authorities have asked for specific accommodations or characteristics or equipment, installing different things in your experience, and what have some of those things been if you've had that experience so far?
I guess I'll go. Oh, Jeff, you want to go?
No, go ahead. I was just going to answer that we have not been to that point yet.
And Cindy, not for you either. Yeah. Well, so I think for us, it's a lot of the stuff that we really want in a regular residence hall room anyway. So, one of the buildings we've been showing to our health partners is none of our residential rooms have carpet in the rooms themselves. And the hospital staff were like, great, we don't want carpet anywhere in patient rooms. That's something that we don't want. I'm like, I don't know about the rest of you, but I don't like carpet in the resident rooms either, for a lot of different reasons. And so we're lucky in that regard. I think a lot of the preliminary discussions we've been having, the hospital folks have their own medically trained cleaning staff that know how to do the kind of cleaning that they would need. And all they do is when they come through in the walkthrough with us, they're like, yep, we can totally do this. We got it covered. Carpeting in the hallway, at least the kind of carpeting that we have nowadays, like the hypoallergenic, the stuff that's like, antibacterial, those kinds of things, it's usually easy to kind of work with. We have not been asked to rip up any carpet or alter any of our buildings. Now that may be something that's coming down the road, but that's not something that we've been looking at or that we've been asked to do. It's really been, and we have some rooms, and that would be great. So.
I will comment that at our walkthrough yesterday, staff who were responsible for that area were saying that they would be removing carpet, but with Josh's comment, I may be able to prevent that because our carpet is not, it's hypoallergenic and there's not a natural fiber in it, so it's easy to clean. So hopefully they could be able to do that without removing it.
Justin Reynolds from the Akuhoi Central Office had a question. Is there any concern about the use of campus residences as alternative care centers leading into the fall term? And has that been a part of your discussions?
Yeah, it has been for us. It has been for us. So one of the things that we've talked about, I think probably one of those things that like nobody's talking about out loud, but everybody's talking about is what are we doing in the fall? Are we going to be having full residential? Are we going to be doing a hybrid or whatever? We haven't really dug into that conversation institutionally yet, big picture, but we have been working into our MOUs with the groups that we're having come in. That like, you know, we're looking at offering these spaces to you for a month, and then after a month, we can renew every week as we go or cancel depending on like for either party. So it's like, you know, we can, you know, imagine we rent out, we let a space go to a campus partner today on April 2nd, and it goes through May 2nd, and we get to May 2nd and we're like, okay, well, we're good for another week. We all agreed, great, you get another week. Next week, okay, we want another week, great. Oh, okay, another week, well, we need to turn our buildings over for the second summer session. All right, one more week and then you all are out and we're gonna transition over. So our legal team has been awesome at that in terms of writing that into the legalese and the MOUs and everything, where we've given them a timeline of when we would need to get the buildings ready for the fall in general. They've given us a few weeks buffer on the front end so that our week-to-week renewal happens before that. So that's one thing that we've done. We haven't like executed on any of these things yet, so it's all, you know, it's all hypothetical right now, but it's one of the things that I thought would be really helpful for us.
We have some experience in transitioning from another use back to our academic year use. We hosted the Minnesota Vikings training camp here for over 40 years. And so we wrote into our, in that example, we wrote into our agreements what the specific ending was and what we would do. And so we would start removing items. And so by stating that you're going to remove the items, it gives you more control as opposed to waiting for a third party to come and pick up items. Then you don't have any control. So I anticipate that we would make those kinds of statements in any MOU we get involved with as well.
Yeah, I would say, like many of you, we all are uncertain of what the future brings, and great questions. I'm looking over our potential draft lease right now, and we put language in there that, has 3 different caveats. So the date in which the hospital has ceased, occupancy is one. Another consideration, 7 days after the medical emergency referenced in the state of Wisconsin that the executive order, is cleared. And then 14 days written notice by us that we need the building back for other use. So that's where, again, the legal experts on your campuses, and I'm sure all of us who are able to share the documents will be willing to share with all of you as well, especially at our public state institutions where we're already getting media requests for them, right? Yeah, it just needs to be written in. And that's where we're trying to, focus really in on maximizing building usage. The hospital said, we'd love that building, and it's 220 beds. And I said, how many people are you putting in it? And they said, well, we want to start off with 50. We said, okay, then we're going to look at this smaller hall because we're going to chunk it out by growth here, and maximize the space.
Victoria Frost from the London School of Economics has asked if you've had to notify or change your insurance policies because of a change in use, and has that been part of the conversation you've had?
Well, funny enough, that conversation just came up for us this morning as we're getting into the latter stages of all this. This is probably different based on jurisdiction and based on state or national or provincial regulations. But a lot of the permitting and coverage and whatnot that would cover the use of spaces, especially if hospital folks are covering it. It sounds like what happens is that the hospital would, if they're using a residence hall, they would name the residence hall as an extension of the hospital. And in that way, it would be covered under the licensure that they have with the local municipality or with the state or the regulating body. we're working out the liability insurance piece, but because we're turning so much over and it's all going to be in that MOU somewhere, there is certainly some level of indemnification that's happening in that. I'm definitely not the lawyer, so I wouldn't be able to speak perfectly to that, at least from our institution side, but it's something that we're definitely looking at. But I do know that if a hospital is taking a space over, their insurance will be covering things that happen in that space. The more challenging part is what happens if there's a flood or a fire or something that is trades related, or something that is theoretically university responsibility to respond to. And that's the stuff that we're still kind of like hammering through and figuring out what that looks like. But I don't know if Cindy or Jeff, you have any other perspective on that.
Those same kind of things. That's why it's important early and often to involve your risk management office on your campus, get the attorneys involved, depending on the use. Again, right now, we're looking at it in partnership with our university hospital. So that changes some dynamics versus an outside entity as well. But important to have all of these items looked at and reviewed, right from the beginning.
I would echo that, and I'm seeing someone's question as well about, what if your campus leadership is telling you something. I think what I would offer is to do what you do every day when your campus leadership tells you something, and that's provide information back to them so they can make well-informed decisions. There are political considerations involved in all of this. I was commenting to my co-presenters before we began that our governor is the person who's given the directives regarding state emergency managers lining up 2,000 beds for hospital care in the state. He's also from our community. And so we think that may be a factor in our residence halls ultimately being chosen, because he will want to show that he and his hometown are supporting the statewide effort.
Right. There's a number of questions, and I won't be able to get to them all individually, but about cleaning spaces and moving students back in after they've been used for medical facilities. And so have you all had some discussions about what that will take in terms of making those safe for students, but also, de-densifying space as we move back in the fall, knowing that, the crisis may not necessarily be completely over, and we may need to continue to watch social distancing and things like that. So if you all have any insight on that, that would be great.
I can just say that from a marketing perspective, we've discussed the importance of taking pictures and demonstrating to our students that the spaces have been cleaned upon their return. Now, Jeff and Josh may be farther along into the planning of exactly how to make that happen, but we understand that it'll be a significant concern for our students and their families.
Yeah, I think I don't know about anybody else in the call right now or in this roundtable, but I found myself learning a whole lot more about this thing from our medical professionals than I ever thought I was going to learn. And I think that one of the things that has been really helpful has been to let our medical professionals share the true, actual medical opinion on things, other than what's either being shared on the news or what's like in the common mindset of folks and what they're thinking. Like for example, our student health folks, our trades folks and our cleaning folks were concerned to walk into a room of somebody who had self-quarantined, but had finished their self-quarantine and had no symptoms. Somebody who is self-quarantined and had no symptoms, there's no medical reason to do anything different with cleaning that room than you would for any other student room. Like that is the medical opinion on that. But sometimes our folks are just like, we're in an environment of a lot of fear, and rightfully so. This is a really dangerous thing. But I think that what I've found is it's been helpful to have our medical professionals explain to our trades folks, our cleaning crew, what the real story is here, and also what kind of cleaning needs to happen. I'm assuming most of your schools have like a norovirus cleaning protocol, and for the most part, the general quarantining protocol and the what happens after an isolation, norovirus spreads easier than coronavirus. And so like the cleaning protocol is very, very similar. And once we have our medical professionals share that with folks, it helps them a little bit. But I think that what we've done is we've made it very clear that we're bringing in our like hazmat bio cleaning team only for our positive cases. So for the buildings that are going to potentially have positive folks in it, of course, we're going to make sure that we have the full deep disinfecting, antibacterial cleaning, the way that they would do it in a hospital. The plus side to working with medical professionals and actually first responders too, police, fire, these are folks who are used to cleaning up things that need to be very deeply cleaned up. And so they have protocols and things like that in place. So, I mean, what I've been kind of leaning on is, you know, we are using our community partners want to use our space, but they have resources as well. So a lot of times they have their own cleaning crew that are cleaning the hospital that can actually clean the residence hall too. As long as we're okay with them coming in, which we are, great. You all know what to do with the space. Just don't, you know, peel the paint off the walls. Do what you need to do and we'll fix it afterwards, you know?
Yeah, I would echo the same things. You know, leverage early and often your environmental health and safety folks on your campus. Also leverage those from the hospital. Reach out. They're willing to share their director of environmental health and safety, their infectious control people as well, and have them come in, talk to your staff. The other thing that the panelists and I talked about earlier too, check with your business services folks on your campus. There are some things here that, and I know we have some listeners from outside the United States here as well, that FEMA reimbursements are possible, potentially up to 75% of some of these contracted, some of the contracted work that's being done. You can't get money back on salaries of your own staff unless maybe it's overtime related to the crisis, but there is funding eligible for bringing in outside contracting groups that specialize in this type of remediation all the time.
Okay. We have a couple more questions about MOUs. You've discussed a couple of things already, but are there other things that you think senior housing officers should really think about and really try to push for in MOUs when they're trying to convert residence halls for this sort of purpose? Other, you know, lessons that you've learned or other things that, you know, you're hoping that will be a part of your own agreements?
Sure. In fact, I'll pull my MOU up on the other screen here and just start whipping off some things to start thinking about. But, you know, obviously the term specifying the use of the premises, the facility preparation that's going to be provided by you or someone else, and ahead of time, who's incurring the costs here? On our campus, we made the decision, the beds are sitting empty right now. We weren't going to be charging for the rooms, but certainly the services associated with preparing them and servicing them while here, and any costs after would be part of our MOU in terms of the reimbursements. Facility requirements and amenities, having that clearly laid out ahead of time. We're housing healthy practitioners. Are they wanting use of floor kitchens or not? Are we making those available to them? The types of facilities in terms of bathroom in room, bathroom not in room. We listed, did they want televisions in the rooms? We use it for conference services. These are our doctors. They might be here for weeks. Is it a nice amenity to add depending on, again, the logistical work on your own campuses? Linens, who's taking care of linens? These are just some of those items to start being, you know, thinking about. If it's a hotel type usage and depending on the client, the population that is there, who's going to be handling all of these linens, garbage collection? Do they want AEDs? This is just a list of just different items you'll all brainstorm on your own campus. Wi-Fi, you know, is that provided? We all do that, you know, mostly. Maintenance, you know, might hire an outside contractor to come and do the actual cleaning if the facility is used for positive patients or practitioners, but who, you know, you might still need some of your own maintenance staff to handle any HVAC kind of emergencies and be thinking about all of that. As well, various covenants, you know, both on housing and the hospital. I could go on. Damage and destruction, who's responsible? That goes back into the insurance pieces and the liability there. One piece, when we were looking at our off-campus hotel, it didn't have an inclusion of it, and now we are including it, possibly the use of residence halls, is Clery reporting. And how does that come into play with an on-campus facility? Also, safety and security of the building. Is your university police involved in response to that building still as well? And getting them involved early, you know, is extremely important. I can stop there and let some of my co-presenters chime in as well.
Yeah, what Jeff said. And the only other thing I would add to that, depending on your local municipality and what, you know, like zoning regulations or like which ambulance company respond. I don't know if anybody else has this kind of situation, but we have certain ambulance companies and municipal support services that respond on campus versus off based on students versus general community. And so like that's all part of the whole thing that we're like, you know, just be aware that if you respond to something here, make sure that your ambulance crew knows that it's not a bunch of students. Like it know the population of what the building is. It's not what it normally would be. Like all the things I would say, just to add on to what Jeff is saying, in general, anything that we would take for granted that we think is like, oh yeah, obviously, of course we charge this much for a lost key. Like those are all things that should be in there too, just because it's better to write them all in there instead of, you know, forgetting to do it, you know?
Perfect. Just looking at our list of questions here that we have left. And thanks to everybody who are submitting these, and also thank you to everybody who are following up questions in the Q&A window with their own responses from their institutions. That's part of what we wanted to see happen was this engagement with each other. So thank you for all of you who are providing those responses and support to other people as well. So Derek Jackson, who's the AVP at Kansas State, was asking, where did you go, Derek? How is food service being provided? And so have there been conversations about providing food services through either your in-house dining or your entity on campus for first responders, hospital patients, things like that?
Yeah, so we've been offering our in-house dining, like we have it's a internal company, like we don't have a Aramark Sodexo, we have our own, like, you know, local company doing our catering in-house. But a lot of our catering staff are looking for things, like not catering, our dining staff are looking for things to do right now because we have such a small number of students on campus. And so they've been offering to folks who may be using our campus. One of the things we've heard from some of the medical centers is that depending on who they're housing, there are specific like needs that they have in terms of food preparation and all that other kind of stuff that they would normally have to go through, where they're just going to provide food themselves to the folks coming in. So Jeff's point before about the medical professionals coming in, for the medical professionals we're looking to hire, the health company, like the hospital company, is providing them with what they need, and we're kind of hands off. But we do have an infrastructure in place where we could drop boxed meals off for folks if they needed them. Depending on who you're trying to house on campus, if you're housing first responders or medical folks, just remembering the fact that a normal medical shift is not necessarily going to be over during a regular meal time. So somebody may be coming to campus at 3 o'clock in the morning and need their dinner or breakfast or whatever it is for them. And so like having that kind of planned in advance is important. We haven't actually gotten to that point yet. But we do have a full food service ready to go for our students, and we do meal delivery for any of our students who are in isolation or quarantine because they can't, you know, go anywhere.
Yeah, great question, Derek. I think that's why one of the reasons we strategically placed the buildings we're looking to use near a dining hall, but then we're also having discussions on, based on the population, the comfortability of even asking our own staff, you know, to serve them. You know, all of our food is to go right now. No one's dining in, you know, maintaining social distancing like all of you are practicing as well. We do have options for kind of boxes to bring two rooms if needed. That was already set up if we were going to need to get there for our own residents and still even those that remain. the hospital, and that's who we're working with, right now, again, for practitioners. We still haven't decided and keyed in on that. They have their own cafeteria there. So as these practitioners going back and forth, whether they utilize that. They've been more interested in actually just having our C-store open for them to be able to go in and grab items, that way. Paul Ryle, a colleague to many of us, he came up with on his campus these hydration stations where he was just dropping off in a lounge in the building, bottled waters and other kind of granola bars and Gatorades, you name it, just for a place for people to go down to the end of the hallway and stock up a little bit. So, those are a few of the things that we've been looking for. But I think this is important then to put into these MOUs as you're establishing them, if they want dining, to what level. And yeah, we'll open the dining hall, but if 5 people show up, it's quite an expense for us to do that. And as well as asking that staff to come in and do it in the first place, that, are there minimum guarantees that you're looking for if you're going to open up a dining hall, is one thing to consider.
At Mankato, we are served by Sodexo, and they have experience in that they were serving the hospital in Wuhan, China. They were the contractor there, so they've got some corporate experience that extends from that. So this is a place where if you've got a third party, you can really leverage that and set up. We're just told our state emergency managers that they would partner separately with our dining vendor.
A person asked a question here. They don't have a name or an institution attached, so it's a little bit diverting from our topic, but this person's a graduate student who lost her living position as a result of COVID-19. She was staying in her on-campus apartment until she was asked to leave to accommodate medical professionals. Are there specific things you're doing to accommodate professional live-in staff who may have their apartments and being displaced as a result of some of these actions?
Yeah, well, first of all, to that person, I'm really, really sorry that happened. That is really horrible. I don't know what other folks' experiences have been in being in some of these meetings, but I think that this situation that we're finding ourselves in allows us as housing professionals to be sitting at tables that sometimes we're not usually sitting at, given the increased focus on use of our spaces and the impact on our residential community. And at every opportunity that I've personally had, I've reminded our senior leadership that the only reason why we're getting through any of this right now is because of our dedicated residential life staff. And that's the only way we're doing it. If we didn't have our residential life staff, we wouldn't have been able to do a full residence hall closing for 4,000 people in 4 days. Like, we wouldn't have done that. We wouldn't be able to manage 130 people in self-isolation or self-quarantine. We wouldn't be able to do that at all. And so one of the things that I've made very clear as we've been thinking about which buildings we're turning to our community partners, we have our full-time live-on staff and our live-on faculty as well, that I've said to our partners, there's a staff member living in this apartment unit in this building. If we need to move them, great, we can move them. We're going to pay for their move. We're going to give them a place to live. We're going to give them enough time. And if we have the ability to, we're going to give them the choice about whether or not they're able to stay or not. And that's something that's been supported by our legal folks as well. So I think that there's a little bit of that's on us, I think, given all of our roles, to advocate for our staff. And at some point, we're going to have residential students, even if it's a smaller number. And we need these staff members, and we need a team for this. And those are the staff that are most connected to our students, most able to connect with our students virtually if needed. And so we've been doing everything we can to do what we can to retain. I will say, though, that we also have a good number of graduate hall director type folks, and we have agreed to allow them, we're allowing them to keep their stipends for the rest of the year, no matter what, whether they're continuing to work or not. And we've given them their apartment until the end of the year, but we're not requiring them to work. We're letting them do things virtually or work with us on special projects or whatever is good for them and their mental health and well-being. But we're being as flexible as we can be with them, because we know this is a very, very tough time, especially for our newer professionals and our graduate staff.
Yeah, I mean, well said. Yeah, apologize for what happened to that individual. Same with us. We've been in close contact right from the beginning on the buildings that we've been identifying with our health professionals. Is our live-in staff able to remain in that building? Is it on separate systems, a separate entrance, just the level of comfortability of the professional staff members still living in that building if it's turned over to a building that's complete COVID positive practitioners or patients. So early on, our Res Life director looked at Extended Stay America and their availability to possibly put people there. We do have our graduate and family housing as well that had some apartment availability. So reaching out early to our professional staff and graduate staff is important. Also being cognizant, Josh, you're right, a lot of housing directors taking the lead. I know there's many on here, and one also reached out, and unfortunately on some of our campuses, the executive leadership out there don't listen to the housing directors like they should. And I can appreciate the difficulty that some of you might be going through. Fortunately, that's not the case here. But inserting yourselves in any way, and I know all of us happy, not just us on the panel, those that are chiming in questions have much more information as well and might be farther along in even their own thinking, even though they've not got there. There's tremendous resources out there amongst all of us to help one another. But yeah, try to get into those conversations, or that's where sometimes it's just better to say, all right, here's them the keys and have at it, and I'm out of here, as much as you can reasonably say that.
Perfect. Well, we are almost at time. We want to make sure that we keep to our schedule for our presenters and for all of you as well. There were a few questions that we didn't get to in the queue. I was able to copy those down, and what I will do is I will reach out to the panelists if they're okay with that, and be able to hopefully provide an answer to the folks. I should have email addresses and things like that for the people that are in the queue. So thank you for submitting those, and we'll do our best to try and answer those. We'll get back to you as soon as we can. Just for the four panelists, or for our three panelists left behind, any last minute words, nuggets of wisdom, any other things that you'd like to share with the group, or things you think people should take away from the webinar and keep in mind?
Well, just responding to unusual circumstances is what we do for a living. And so if you're concerned about being called on to do this, just lean into the skills that you have. You have skills at looking at all of these people who are coming to you and recognizing where they're at and helping them focus on the goals and the tasks to get there. So that's what I offer. And thanks to the community.
I'll just say thanks again to everybody across the campuses who do what you do every day. Also, don't forget to recognize often the staff throughout your departments and divisions who are out there busting their ass. Busting their butt, day in and day out right now, doing unbelievable things that no one in our lives would have ever imagined. And recognize them, advocate for them. As much as we're all looking at some potential losses financially, it doesn't mean we shouldn't try to figure out, even if there's a way right now, to recognize that staff in any way we can. It's just amazing what they're doing. And yeah, all of you, thank you. And I mean, I hope we see each other in June, but even the uncertainty there is so disheartening right now.
Yeah, I mean, I would echo what both Cindy and Jeff just said. I think it's also really important, in addition to recognizing and supporting our residential life and housing staff, our custodial staff, our dining staff, the university police, and other first responders and other folks who not only on our campuses and in our communities are really putting themselves in harm's way in a way that they haven't had to before. It's something that I know we've all we've all seen and we're all kind of in that with folks. But you know, I just thank you to all of you for the work that you all are doing. If anybody has any additional questions, we'll certainly try to answer the ones that Grant came up with. But I mean, at least for me, feel free to reach out individually. You can find me on our Tufts website, and feel free to reach out. I'm happy to chat with folks. I mean, I think that's one of the best things about Akuhawai as a community, that we have this network of professionals where we can rely on each other and back each other up and just, you know, be with each other. So whatever we could do, and thank you again for taking time to be here.
Wonderful. Well, I wanted to say thank you to our three panelists who joined us this afternoon. Clearly, they're busy on their campuses, working on lots of different areas of response and managing things, as many of you are. So thank you to them. Thank you to all of you. I know that the times you're working in right now are unprecedented. I used to work in the profession for 17 years, and so my heart and my head is with you all as you continue to do extraordinary things every day for your students and your staff and your community. So thank you so much. One of the things that I want to make sure that you know about is we have a resource page, and there's a link available there as well off our main page. And so things that we have, everything we have access to, our COVID-19 resources, our ongoing resource page that has a sampling of different pieces of information that we hope you'll find helpful is there. We've been doing straw polls recently through our research department, and the straw polls have been gathering real-time quick data from our institutions. And so we thank you all for participating in those. If you have not, you'll see one coming out early next week that will ask you some questions. And people have said this is a really helpful way to find some real-time data and do some quick benchmarking about what other institutions are doing. There were a lot of questions today on the back channel about how different schools are managing and coping. And so this will be a great way for us to record some of that data and provide, you know, some more big picture things for you to take a look at. Tomorrow we have one more virtual roundtable at 3 p.m. Eastern. It's a facilities roundtable. So if you or your colleagues work in the facilities, we're hoping that this will be an interesting discussion. We have about 6 panelists to join us tomorrow to share some of the things they're doing in facilities, land, managing staff, managing resources in a time of crisis. Next week, we have a virtual roundtable on Tuesday, April 7th called Building Community from Afar. We're hoping that individuals who are managing staffs from working remotely, who are not necessarily on campus or who aren't meeting frequently face-to-face, we're hoping that this will be an interesting webinar for you to attend to see some strategies and some ideas that you can use to help build community among your staff and among your colleagues as well. We'll also have a virtual roundtable schedule for the week of April 13th. Announced on our website soon. That will be on the front page of the Akuhawai website. So you should be able to click on there and it will offer you the slate. We hope you continue to sign up for these. We love doing them for you and we love bringing people on board who are willing to contribute. So, and as well, if you have suggestions, if you have ideas about who would be a good panelist, you know, we would love to be able to hear your ideas. So you're welcome to email any one of us in the Akuhawai Central Office. If you go to our staff page on the website, you can find me, you can find Spencer, you can find any staff member, and we'll collect that information. So feel free to email, and we would love to hear your ideas. As long as you're willing to come to these, we're happy to put them on. Okay. And again, make sure you check out our online resources. This will be recorded as a YouTube channel recording. Shortly after. It may take us a few hours to get it posted and ready to go, possibly by tomorrow. So if you or another colleague would like to look back on this or you'd like to share it, it'll be available for you to do that. Again, lots of the back channel conversations today have been wonderful. The Akuhawai online community is a great place to continue those. And much in the same format that we've been doing as well here today. You can continue there as well. And it's amazing how many people are willing to share their expertise and their ideas with you. So we encourage you to use that. And again, our COVID-19 resources page with links to lots of different organizations and associations to provide some guidance and good information about the current epidemic and how it's being managed. We're hoping that you find those useful as well. Okay. Well, thank you all again. We really appreciate your attendance this afternoon. Again, we'll have the recording available on our YouTube channel in short order. Thank you so much for being here. We look forward to talking with you again very soon. And thank you. Take care.